Welcome back, guys. I hope you are all doing well. So, today's my topic of discussion is about the second part of the temporal lobe, which is auditory association area. In previous video, I explained briefly about the first area of the temporal lobe. If we concern the cortex of the temporal lobe is primary auditory cortex. Now, today's my topic is auditory association cortex, which is the second area. I explain you about its function. Okay, how it function in the practical form. Okay, so first I draw this area. I draw the lateral view of the brain. This is our brain. Okay, in previous video I explained this area, related pathways, all these area. This is primary auditory cortex. Okay, what is this? This is primary auditory cortex, which receive the conscious awareness of the sounds like frequency, pitch and localization of the sound by using the pathways. In previous video I explained all the pathways related to that, so guys, please watch that video first and then come to this video. Okay, so a little bit I explain it. This is over here, and the when the voice come to the ear, how it travels from the internal ear. Okay, it goes towards the information goes towards the vestibulocochlear nerve, which is the eighth cranial nerve. Okay, and then it goes towards the area, respected area, which is the primary auditory cortex. Okay, in previous video I explained all the pathway related to it, so must watch that video. So now today's my topic is the second area, which is just inferior to it. What is this area? Auditory association area, the orange in color. Auditory association area. What are the function of this area? I tell you in practical form later on. Okay, so now first I tell you the information, how it comes and how it moves towards this area. So the information from the internal ear goes towards in this direction, towards the which area? Primary auditory cortex. Then it enters in the auditory association cortex. Okay, the information enter in the auditory association cortex. Okay, for the more explanation about the information, it's a function of the primary or say auditory association cortex. What are the function of it? Tells the what are the meaning of the sound. Okay, what are the meaning of sound, what type of sound it is. Okay, any information, any type of sound you heard in a past history or not, any previous history. Okay, all are stored in second area. What is this area? This is auditory association area. Okay, so I give you some example related to it. So someone say to you, okay, hi, how are you? Okay, okay, it's a meaning. Okay, you can answer to that question, hi, how are you, and you say I am fine. Okay, okay, a simple word. Okay, a simple sentence. Okay, you know the meaning of that sentence. How you know the meaning of that sentence? Because of auditory association area. And when someone says hi, how are you, like very not in a light manner, in a hard manner, and you have to heard it and you say I am fine, like this type of response you give. Okay, so how the information goes towards this? Through these pathways. First primary auditory cortex, then it moves and compare the information to the auditory association cortex. Okay, and answer on that manner, you have to give the answer. Okay, so guys, this is all about this area, auditory association area. What are the functions of it? Its function is what are the meaning of the sound. Okay, and how I respond, I compare that sound. First, the sensory input. What are the sensory input? When someone talk with you and their voice is enter in your ears. Okay, your internal ear send information through the vestibulocochlear nerve towards the primary area, which is primary auditory cortex, which controls the conscious awareness of the auditory stimuli. This is your input, all the input. Then it sends this information to the second area, which is auditory association area, for the recognition of the sound. What type of sound it is it loud, is it slow, and what type of manner of the sound. Okay. And that sound is present in the past memory or not. Okay, you know what are the answer of hey how are you. Okay, because of your past memories store that information. Okay, I know the answer of it and you respond to it. Okay, I am fine, like this type of explanation. So guys, this is all about the second area. Okay guys, you must watch this video. Please like, share and subscribe it, and please press the bell icon for receiving any new video. Okay, in the next video I explain a lot about the Wernicke's area, okay, of the temporal, near the temporal lobe, parietal lobe and little bit occipital lobe. There is a Wernicke's area. Okay, I tell you the complete explanation related pathways and clinical importance related to it. Okay, so now in this video I explain you the clinical importance related to that. Okay, when there is damage to the vestibulocochlear nerve, okay, the nucleus which is present over here, the vestibulocochlear nerve nucleus, okay, here is damage due to any trauma. Okay, the damage to the pathway related to the information which is input. Okay, you cannot hear it, you can, okay, you can hear it but you cannot even know the meaning of that. Okay, you hear it but you cannot know the meaning of that. Okay, so because of the second area is damaged, you don't know the meaning, you don't know the meaning of the sentence of any person talk to you. Okay, but if there is damage to the first area which is primary auditory cortex, you even cannot receive the information, you cannot hear properly. Okay, so these are all pathologies related to this pathway. So what are the importance of it? When there is damage to the primary auditory cortex, you cannot hear any person, any sound properly. When there is damage to the second area, okay, which I discussed today in explanation, you hear the sound but you don't know the meaning of the sound. What are the meaning of sound, what type of response I give against this information, this sensory input. Okay, you don't know the meaning of it. Okay, so guys, this is the clinical importance related to that. So guys, you must know the pathway which I discussed in previous video, and in this video I explain a little bit about that pathway and also explain the second area and also related to the clinical importance. So guys, I hope you understand it. Please like, share and subscribe, and please press the bell icon for receive any new video. So guys, goodbye, be happy.